Thank you for joining us for a conversation on nursing, climate change, and health in Georgia. This is hosted by Georgia Nurses Association and the Alliance of Nurses for Healthy Environments. And today we're going to discuss how nurses can play a vital role in promoting understanding of climate change as a health issue, as well as advancing nursing practice to prevent and protect against health threats, and advocating for protective policies for both environmental and public health. So for attendants who are unaware, the Alliance of Nurses for Healthy Environments, or ANNE, is a national network of nurses with the core mission of promoting healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. ANNE is the only national nursing organization focused solely on the intersection of health and the environment, and is a transformational alliance preparing and engaging nurses to assure the environmental health of all people, overcome environmental health disparities, and to heal our communities and the earth for present and future generations. The alliance is comprised of nurses from a broad range of geographical locations and nursing specialties, all with a unifying desire to protect public health through fighting for environmental policies. And with the increasing severity of climate issues and the clear impacts on public health, which we'll outline today, we'll understand why our efforts are now more important than ever. ANNE is structured with 4 forums, including education, research, policy and advocacy, and practice, and 2 committees, which include climate change and food and agriculture, which members can participate in and network with nurses across the country. So we also will have an outline slide that has our objectives that we're going to cover today. And at the end of the session, attendees will receive a post-test to submit back to Georgia Nurses Association to complete for CEs. So our first panelist is Dr. Roxana Chicas, who is an assistant professor in the Nell Hodgson Woodruff School of Nursing. Dr. Chicas earned an ASN from Georgia Perimeter College in 2015, a BSN from Nell Hodgson Woodruff School of Nursing in 2016, and a PhD from Emory University Laney Graduate School in 2020. Dr. Chicas's research experience in occupational and environmental health and nephrology, along with being a bilingual bicultural investigator, equip her with a unique set of strengths and skills as a nurse scientist. Dr. Chicas conducted the first field-based intervention study of methods to reduce core body temperature using real-time biomonitoring equipment among farm workers in the United States. Excuse me. Next, we'll hear from Lachey Haynes. Lachey has been practicing in the area of obstetrical perinatal nursing for nearly 26 years. Her clinical and educational experience and expertise span labor and delivery, antepartum, and mother-baby. Lachey has worked as a board-certified clinical nurse specialist for women's services at a large healthcare system, where she was a nursing instructor and a perinatal outreach educator. These roles allowed her the ability to provide continual high-risk perinatal education to various hospitals and to reach audiences across her region. This has led to her current role and success as a founder and owner of her own nursing mentoring and education consulting company, Perinatal Potpourri. She is also a designated instructor in fetal monitoring and obstetric patient safety through AWAN. Lachey holds 2 certifications through NCC and currently provides in-services and seminars nationally for inpatient OB and EFM reviews, respectively. In addition to being an active AWAN member, Lachey was recently elected as the vice chair of the AWAN Section Advisory Committee. She was appointed to this position because of her activism and success as the 2-term elected Georgia Section chair. Lachey was appointed as the lead for Georgia in the AWAN Postpartum Hemorrhage and Empowering Women projects. She was selected as the lead facilitator in the state of Georgia to assist with the rising rate of maternal deaths because she has successfully moved her region to become more active with lectures, networking, and current trends. Lachey's expertise in this area is demonstrated in her most recent honor, AWAN's highest honor, the Distinguished Professional Service Award winner of 2022, and the Award Excellence in Education, respectively. It's also noteworthy to mention she has won the March of Dimes 2018 Georgia Nurse of the Year Award and the 2015 AWAN Award of Excellence in Community Service. Finally, we'll hear from Carrie Ritzler. Carrie Ritzler joined the Southern Alliance for Clean Energy in 2022 as SACE's Georgia organizer, working with volunteers and leaders around the state to promote clean energy policies at the local, state, and federal levels. Previously, Carrie has worked in affordable housing and local government, supporting sustainable development and policies. Carrie has been an active advocate for climate policy since 2015. Carrie is a leader and founding member of the 100% Athens Clean and Renewable Energy Initiative, which worked with Environment Georgia and the local government to set a target of 100% clean and renewable energy by 2035, and serves as co-chair for the Just Energy Circles Policy Committee. Carrie has a bachelor's degree in anthropology and a master's degree in special education. She is currently pursuing a second master's degree in public administration through the University of Georgia's School for Public and International Affairs. Now I will turn it over to Dr. Chicas for her slideshow and remarks.
Hi, everyone. Thank you, Jessica. Thank you, everyone that has joined us for this presentation. Let me go ahead and share my slides. Okay, so I'm going to talk to you today about climate change and associated health impacts in research studies that we have found. So I want to start off by just letting you know that fossil fuel generated air pollution and climate change surpass $820 billion in healthcare costs each year. So it has a profound effect on healthcare, the nursing workforce, our communities. It is extremely impactful. And so what we mean by climate change is that this refers to a long-term shift in temperature and weather patterns. And the primary driver of climate change is human activity. So the burning of fossil fuels, of like coal, oil, and gas. So here I just want to show you kind of how the temperature has changed since we started tracking temperature. And you can see here from this graph that temperature has been increasing. And it's expected to continue increasing unless we start doing some impactful changes to mitigate that. You may or may not know this, but there are more yearly deaths attributed to heat than to any other weather-related disaster. So climate change causes extreme weather events like wildfires. I'm sure you've seen those like on the news, food shortages, disruptions of emergency services, supply chain challenges as well. They have the potential also to affect access to adequate water, nutrition, health-sustaining medications, and equipment. So the health impacts change include heat-related illness, which we'll discuss, respiratory complication, vector-borne, foodborne illnesses, waterborne illnesses, and mental health effects. So it's critical to recognize that human health is inextricably linked with the health of our planet. So heat-related deaths and illness. So research has shown us that agricultural workers are 35 times more likely to die from a heat-related death than any other occupation, and that's followed by construction workers who are 14 times more at risk. So outdoor workers are a population that are vulnerable to these heat waves that are happening and becoming more frequent, and they're lasting longer. There's also, we've seen through research, exacerbations of existing cardiovascular and respiratory and diabetes-related conditions. So which means that when we have those conditions worsen, and they may, people end up, having to go to the doctor more, having to go into the ER because of this. Higher temperatures have also been associated with preterm births. Now, climate change also has an impact on mental health. So globally, there's been large swaths of populations that are being displaced and forced to migrate, to leave their countries because of the effects of extreme heat, including climate-related drought, crop failures, food shortages, sea level rising. So these stresses all contribute to civil unrest, to conflict, and to war, and causes people to migrate. And as you can imagine, that when you migrate, when you leave your home, or when there is a disaster that's happened in your home where you've lost your community, like when Katrina happens, or when we have these storms that come in, these floods, it really impacts people's health. So the journey to rebuild communities is a long one. It's very expensive and is associated with significant loss of well-being and post-traumatic stress, suicide ideation, historical trauma, loss of jobs and incomes, relocation, and long-term disruption. And oftentimes these are communities of color, low-income communities that are the ones being mostly affected. So climate-related disasters, extreme heat, and climate change associated anxiety, or it's also called ecological grief or solastalgia, is another condition that we're starting to see. There's a study done with teenagers and young adults, and many of them talked about this fear of what's going to happen with the planet and climate change, and having just emotional distress caused by the environmental change. Air pollution is also something that we should pay attention to. So because, air pollution, oxygen, we need oxygen to breathe. Otherwise, nothing really matters, right? So poor air quality, both outdoors and indoors, can have a negative effect on your respiratory and cardiovascular system. Increases in asthma episodes and other allergic illnesses. We see that climate change, we're having longer seasons of pollen. And particulate matter smaller than 2.5 microns in diameters are also associated with serious chronic and acute health effects, including lung cancer, COPD, cardiovascular disease, and asthma. And there's also been studies showing that air pollution is associated with preterm birth or low birth weight babies. Again, air pollution happening mostly in communities of colors and low-income communities. We also have vector-borne diseases that we are seeing, like Lyme's disease and West Nile virus that we are seeing more and more of. There's also been this association with heat waves and acute kidney injury or chronic kidney disease. That chronic kidney disease kind of being seen in some of the tropical regions, but acute kidney injury, we have seen it, it's been documented to be happening in agricultural workers in Florida and California. So again, it's another associated kind of disease that is impacting our population. And here we just have kind of a graph that shows like the climate drivers, the exposure pathways, and how environmental, institutional context, and social and behavioral contexts all kind of come together and have these negative health outcomes. So populations with greater risk for health impact of climate change are pregnant people, children, older adults, indigenous people, and also occupational workers. Many of who work like outside, you may or may not know this, but there are no federal heat protection standards, which means that it doesn't matter how hot it is outside, there are no protections to protect workers when it's really hot outside to say, these workers need breaks, they should have water, they should have shade, that is not in place. And so because of that and other factors, that has led to this, for them to be at high risk for a heat-related death mortality. So oftentimes, when we talk about climate change, we talk about, how it impacts our planet, our communities, our patients. But I think it's also really important to think about how climate change will impact the nursing workforce. And COVID-19 has kind of shown us how when there's a public health emergency, it really puts a lot of stress on the healthcare system, especially the nursing workforce. And I think climate change is something that we need to start to think about and how it's going to impact the nursing workforce. If more patients are going into the emergency department, becoming more sick of heat-related, of climate-related sick illnesses, then that will definitely have an impact on the well-being of nurses, the demand for nurses. So the compounding effects of climate change in relationship to existing nursing workforce issues, so increased staffing workforce strain. And, there's also structural damage, power outages, disruption to sanitation, water, things that, as a nurse, you'll have to deal with if you're part of, in working in a hospital or healthcare system. Supply chain disturbances are also something we have to think about. And COVID-19 showed us that there will, there are supply chain disturbances that usually are unexpected, but climate change has the potential to also do that. And again, increase in patients' needs, medical and psychosocial. Here's just a graph kind of showing how there is an increase. So healthcare supply chain disruptions. So what it is currently about 50% in the near term, you see that it increases, and long term it continues to increase. So this is going to have a massive effect on the healthcare system and the nursing workforce. And this is just like to end my presentation. This is a quote from the National League of Nursing, who put out a statement on climate change, the importance of nurses being educated on climate change. And they said, nurses must not only be educated in nursing care related to climate change, they also must be prepared to address personal and professional needs related to their own resilience during existing and future climate change challenges. And with that, I end my presentation.
Thank you very much for your remarks, Dr. Chicas. I'm going to turn it over to Lachey Haynes now.
All right, I want to. Beginning here. Okay, are you able to see that?
Yep, looks good.
Okay, great. Okay, so I'm going to continue the conversation about environmental changes and health equity, and again, how that impacts our mothers and babies across the state of Georgia. So some of the things that we're going to talk about in the next 15 minutes is just defining weathering, looking at health equity in that context of, again, that childbearing woman and how the climate changes and just environmental changes, how that affects them, how that attributes to our discussion of maternal morbidity and mortality in Georgia. As you know, we teeter between 49th and 50th as it relates to our maternal morbidity and mortality. So all of these things that we're discussing really has a large impact on our moms and babies here in the state of Georgia. And then also just reviewing some of those environmental changes and their effects on the overall health. We've kind of already touched on some of those, but again, going into overall health, wellness, and the pregnancy. So we want to start off with a couple just some definitions, and a lot of this information you'll see is in my reference. The American Public Health Association, so APA, has a really great website. When you go there under health equity, lots of different helpful information there. And so one article that I looked at in particular was Creating a Healthiest Nation, and it talked about environmental justice for all. And so it identified some of these weathering. We're kind of going to talk about a little bit more specifically in the next slide. So I'm going to jump right to just kind of giving us some clarifications for the information that I'm going to share. Fair treatment means no group of people should bear a disproportionate share of negative environmental consequences from policies. So as we keep hearing the theme of marginalized communities, people of color, things of that nature, that it's affecting them a little bit more. So, I think one of our goals globally, right, across the US is going to be fair treatment. So I think it's fair to use that as a statement and a request in any of the policies moving forward as it relates to climate and environment, to really make sure that we're intentional and looking at people of color and marginalized communities and identifying if we've thought about that, if we've taken time to ensure moving forward that our policies are including those that are affected the most by some of these historical policies that have created these consequences. Meaningful involvement kind of ties into what I just said of allows people to participate in the decision and make contributions with the power to influence agencies' decisions. So I think that again, including people maybe from those neighborhoods. I think sometimes where the disconnect comes in is not including the very people that we're discussing, right? And not bringing in the marginalized communities. And sometimes we're well-intended, right? We think we may know what somebody wants or needs, or we may feel like, well, we're giving them this, and so that should be good enough. But it really, really helps when we reach out to the community at large and find out specifically from them what kinds of things are really impacting them. In particular, because we're saying that this even impacts their mental health, right? It would be really beneficial for us to reach out to them and find out what are the things, those top 3, maybe top 5 out of 10 things that you feel like really attribute to your anxiety and depression. And so really bringing them to the table is going to be really important as we move forward in this work. Environmental racism. Didn't really realize that there was a such thing, but any environmental policy, practice, or directive that differentially affects or disadvantages, whether, again, as we just said, intentionally or unintentionally, individuals, groups, or communities based on race or color. It's a form of environmental justice administered, reinforced by government, economic, political structures, and institutions. So this, shifting costs away from maybe marginalized communities. So we want to make sure that when, again, going back to what we were saying earlier, that we're really looking at our policies and actually asking the question. So how we could become intentional is saying, wait a minute, before this policy goes through, is there anything about this policy that could create more of a disadvantage for communities that are already marginalized? And then climate justice. So highlights the uneven burden of the negative consequences of just the climate change. Roxana had mentioned earlier about some of the harms in vector-borne diseases, water supply. For years, we've talked about the water supply and the effect of that in Flint, Michigan. We've added in Jackson, Mississippi, and the list kind of goes on of concerns. And even just now, clean drinking water here in the US, where, for a long time, I think that was something that we all thought that was more of something you saw in third world countries. And so to hear about major cities here in the United States that have issues with clean drinking water, it's a little bit closer to us than we think. And so making sure that we're looking at those things, low air quality, water quality, disproportionately, as we've said before, burden communities of color and low income communities. Okay, so I said that we would go over a little bit more on weathering. And so AWAN, our Professional Association for Perinatal Nursing, came out with an article titled Moving Towards Health Equity by Addressing Social Determinants of Health. And so that was one of the first articles that I saw that really gave me a good, clear perspective kind of on the weathering and that sort of thing. And it talked about how the human body was designed to manage episodic stress and has protective mechanisms that can return that body back to allostasis after extreme physical and emotional distress. However, stress that goes on for very long periods of time, poverty, unsafe living conditions, food insecurities, and as we know, if we go to the marchdimes.com/peristats, PRISTATS, we will see the increasing amount of food deserts that are affecting our communities across the US. And we're going to look at that for a second and even just look at that burden in Georgia on their maternal vulnerability index. oppression, abuse, racism, and other determinants are creating this long-term, right, chronic stress. So that in itself is what is leading to some of these changes in autoimmune, potentially diabetes, neurologic. So we just talked about anxiety, depression, and your PMADs, your perinatal mood and anxiety disorders. This can certainly attribute to some of that before and even after having the baby, so prenatally or postpartum. It links to those kind of conditions as hypertension and also preterm birth. And we'll look at in a few minutes that our score, our most recent score that just came out, is an F. So with our preterm labor rate being an F, that kind of ties us back into some of the things that we're just talking about, where maybe there is more chronic stress here in our state. And so that is attributing to some of these conditions and outcomes, which then affects everybody, right? When the healthcare costs are increased, then it doesn't just affect people of color in our marginalized communities, it then affects all of us. It can overburden the healthcare system, increase our costs for private insurance. And so I think we need to start looking at these things as it is not something that just is their problem, right? I don't live in that community. I don't know what's going on. It does really affect us all in the state of Georgia. So really, trying to be intentional again in looking at, what can we do to maybe fix some of the problems here. And so social determinants of health, in addition to poor health, which can come from some of the chronic stress and some of the things that we just listed, right, can then lead to premature aging. And so the premature aging is the weathering of the body. So it accelerates kind of the aging process. And so things that we wouldn't expect to see in a healthy adult until maybe they're in their 80s and 90s, we're now starting to see in their 40s and 50s because of that chronic stress and the things that the stressful situations that someone would be dealing with for a good portion of their lives. Okay, so a couple things. So climate justice, I just kind of mentioned some of that. We touched on that in looking at that creating the healthiest environment article. So again, those uneven burden of negative consequences of climate change, and really looking at where some of our low income communities have been built and developed, and where they are they near, as in our first presentation, toxic waste chemicals. When I'm riding through, visiting sometimes in Florida or maybe Texas, and I see a new subdivision, you can see how fancy and swanky some of the windows are at the top, right? Where they have these energy efficient windows or for the extreme heats that are there. But do we have things put in place like that in our low income communities? And do they have access to maybe multiple air conditioning units, to keep the houses cool in times of extreme heat? Or some of those, just again, those energy efficient things that we're seeing that are being built into new homes. Has there been a budget made available so that low income housing and properties can also be updated, even if it's every decade, to have some of those increases. Okay. All right, so this is what I had mentioned earlier that we would discuss the Georgia, and this can be found, you'll see it there at the bottom of the slide on marchadons.org/peristats. You can go to the report cards and it'll specifically bring up each state. And so the one thing that was notable to highlight here, if you see the areas there where the maternal vulnerability index is very high, is the dark purple, most of our state. Right, most of our state is in that dark purple. And so when you really dig in to this maternity vulnerability index, you will find that there are numerous factors that they look at in order to measure and determine who is at highest risk. And so it's reproductive health care, so access to care. Sometimes even going back to social determinants of health, what I often see is people describing that and only kind of identifying that as a person is too poor and making it their problem, right? She's too poor to get to the doctor, or she doesn't have a babysitter for her 3 kids to make it to her MFM visit. And what we're leaving out is that the MFM visit is 3 hours away. Right? So 3 hours to and back is a 6-hour-a-day commute. So you're really asking somebody, and then squeeze in that time for the appointment. We're asking her not only to drive somewhere, take off work, but then also find somebody to watch her kids for over 9 hours while she makes that appointment. So I think looking at things at more of a macro perspective, rather than looking at it as an individual micro level of what's going on with 1 or 2 pregnant people, and looking at how much of the state of Georgia is in the very high area. So this tells us that these are policy issues. These are structural issues. These are not individual household issues of a random 3 or 4 people that may live in your community. These are huge problems that really are on a much higher level. So it's going to affect their physical health, as we just talked about, the weathering, premature aging. So we see their physical health. We see that it affects their mental health. And sometimes when people have issues with mental health and physical health, they may self-medicate. So you're going to then start to see increase in substance abuse. General healthcare, right, as a whole, is going to be affected. And then again, those social economic determinants and their physical environment. I had learned this was something I was unaware of, living in a more, urban suburban area of Georgia, that there were areas that had dead zones. And so I didn't even know what that term was. I said, well, what is a dead zone? And it was areas that did not even have internet access, not very far from me, 50 or 60 miles away. And I just couldn't imagine not having internet access, right? As we are here today on Zoom, and how much I use my internet on a regular basis from the time I wake up to the time I go to sleep. Everyone in this house uses internet access, and I just could not imagine living somewhere in a dead zone, because then there's so many other things people would not have access to. So jobs, working from home, the ability to get an Uber. I mean, you are just really isolated, and if part of your pregnancy care is maybe online, or there's downloads or information that you're receiving, even just confirmation for your appointments and things like that given via email, it just really can restrict a household there. And so this I had mentioned earlier as far as our our score here in Georgia. And so right now we do have some opportunities for improvement. Our birth rate is 11.9%. And we see that also has been broken down. The infant mortality is 6.1, so we have some work to do there. And then they also look at the race and ethnicity. And so just looking at, again, those social determinants of health across the board. And we see that we do have needs for improvement there. And in our Atlanta area, it has worsened, where that score is continuing to worsen instead of improving. We are having some challenges in that area there. And then our Georgia maternal morbidity and mortality has given us some of the leading causes of death, 83%. I think the key to this is kind of almost what I started off in, is 83% of the pregnancy-related deaths were determined to be preventable. So I think that it's great that we're having the conversation today, and we're talking about all of the ways that we can maybe improve access, care, accessibility to food, transportation, the climate changes, the environmental changes. Any of those things that we do can all help to attribute to these preventable deaths. And they continue. I had the privilege of sitting on the Maternal Morbidity and Mortality Committee for 5 years at our infancy, and that continued to be, even then, preventable deaths were the majority of them. So the good news is that we can make a difference, and our impacts really can help our moms. So long-term recommendations to include case management services for patients and families up to a year postpartum. I think that's also going to help us in the area of ensuring that we don't think that we know their needs, and we're putting things in place that may even actually make their needs worse, but really making sure with having case management, specifically dealing with these families across the state of Georgia, I think that'll really help us to exactly be able to hone in on, what are the contributing factors, and what can we do to maybe support and fix those things. The environmental impacts also polluted, oil, gas infrastructures. And I think you guys had a little bit on that in the very beginning. Poor air quality, which can create asthma attacks. And so for a woman during pregnancy, we know that can put her at huge risk. So asthma attacks, nausea, body spasms, headaches. And if you think about it, things like nausea could just be attributed to the pregnancy. Well, here, this is, she may be impacted by air pollution and things of that nature. So even just nurses being aware that those side effects could be related to her environment of maybe wherever she works or where she lives. And so maybe having additional questions on our assessment forms, particularly if we're going into areas that we know that there is great need, or on that maternal vulnerability index, if and you identify that you live in one of those areas of concern, to have special note and pay special attention that those headaches and some of those other things may not be normal pregnancy signs, but could be related to some of the unequal air, major roadways, our source of noise, pollution, hazardous air can create particulate matter. Things of that nature. So the proximity, again, maybe even asking them particularly where they live. And there is an unequitable burden of low-income communities and communities of color that do live near these roadways. I do have, again, in the reference section, about 2 slides, we're going to talk about Segregated by Design is actually a YouTube video. It's about 17 minutes long, and it actually talks about the intentional structural racism in the country of dividing Black communities by creating highways right through their communities in order to disperse families of color, things of that nature. So Segregated by Design, you can't just Google it. You actually have to go to YouTube first, or you won't find it. But I do have that also in our reference section. And so then really just looking at the impacts of health also on housing. So making sure not just having housing, but quality, affordable, and maybe location too, that, are not going to affect health outcomes of our pregnant moms. Going back to our American Public Health Association, another point that I found to be notable in that creating the healthiest nation and environmental for all mentioned that race is the was the number one indicator for placement of toxic facilities in the US. And in 2007, more than half the people of color lived within 1.86 miles of a toxic waste facility here in the US, and they were people of color. So huge disparities there in some of our marginalized communities. And some of these pictures that I have are subdivisions or public housing that is right here in the Atlanta, Georgia area. And so some of the additional information that I found and looking across public housing across the Southeast, it talked about infestations. Some of their major concerns are infestations of bed bugs, broken or painted over sprinklers, broken doors and windows that won't lock, mold in ceilings and walls, dangerous and unsanitary conditions, people living in it mentioned that Alabama was one of the worst housing properties to live in today. Public housing, maybe looking at some of the federal inspections to determine where these failures are and what we can do to maybe improve some of that public housing that is offered to our pregnant moms within our state and within the Southeast. And then finally, as I mentioned, some of those roadways and really looking at environmental conditions, and are there ways if we get the opportunity to be a part of new housing developments that are being developed or moved or things of that nature, looking at volume and street designs, pedestrian injury, fatality become more common in low income communities. So maybe again, getting more signage, speed bumps, even smaller things like that, maybe something that we're able to do to help to support our communities. And then finally, I do suggest going to that Segregated by Design YouTube video. It's about 17 minutes, and it really does kind of help to give some of the historical context to where housing projects have been developed, and some of the things that we've already mentioned about the air pollution, paint, toxic paint, fuels, all of those kinds of things that they may be exposed to living in those areas and under those conditions. And that is it for me. Thank you.
Thank you very much for those comments, Lachey. Now I'm going to turn it over to Carrie to finish it up. And then again, if folks have questions, please feel free to put them in the Q&A section of the Zoom, as we're going to try to leave some time at the end to discuss.
All right, thank you so much. I'm going to share my screen and start my presentation. Okay. Hi, everyone. Thanks so much. I'm so glad to be here and honored to come after these two amazing presentations. I am Carrie Ritzler. I'm the Georgia organizer for the Southern Alliance for Clean Energy, and I lead the Renew Georgia Grassroots Action Campaign on behalf of SACE. The Southern Alliance for Clean Energy, or SACE, is a nonprofit organization that promotes responsible and equitable energy choices to ensure clean, safe, and healthy communities throughout the Southeast. As a leading voice for energy policy in our region for over 30 years, SACE has focused on transforming the way we produce and consume energy in the Southeast. Renew Georgia as a campaign aims to bring Georgians together to demand clean, safe, and prosperous future for us all. I'm going to talk to you today about the health impacts of our energy choices, which overlap with the health impacts of climate change, of course, and the policies that can help with the clean energy transition, and then how you can get involved in those policies. Okay, so I'm going to start. The next 3 slides are sort of just to get us all on the same page and some review from the other presentations. I'm going to start with some definitions and then talk a little bit about the health impacts of fossil fuel energy specifically, which is the key driver of climate change. And then we'll move on to some clean energy opportunities. And I just glanced at the Q&A. I am going to be talking about the Inflation Reduction Act and the EPA also. So that's great that whoever brought that up. The fossil fuels, as Dr. Chica said, are coal, oil, and gas. These come from fossilized plants and animals, and they are burned to create electricity, move our vehicles, move our people around. And these include consumer products like gasoline, natural gas, and propane. Clean energy, on the other hand, is non-polluting energy, generally produced from the sun, wind, or water, and it can be used to create electricity, which can also be used to heat our buildings and move our vehicles and people around. Clean energy can be produced on-site with rooftop solar or ground-mounted solar, or it can be produced on big solar and wind farms or at hydroelectric plants. Greenhouse gases, as we've talked about, are the heat-trapping gases that are also emitted from fossil fuels and include carbon dioxide and methane. I'm going to talk about 2 federal policies that were passed in recent years, the Infrastructure Investments and Jobs Act, or IIJA, which was passed in November 5th and includes more than $40 billion in climate smart investments, and the Inflation Reduction Act, or IRA, which was passed on August 16th, 2022, and includes $369 billion in climate investments through grants, rebates, and tax incentives. Finally, I just want to mention the Justice 40 goal that 40% of the benefits of climate investments will go to disadvantaged communities. And Georgia has a lot of what are termed Justice 40 communities. So these laws are particularly applicable in those communities. So just to briefly review, because I think the other presenters have also said this, but burning fossil fuels for energy causes air pollution that's visible and invisible. So the air pollution, such as soot, smog, and particulate matter, directly harm human health when we're exposed to them. And then the greenhouse gases are also emitted, often invisible. Carbon dioxide and methane, you can't really see it. But these are the primary drivers of climate change and global warming. Health impacts, as we've said, include asthma, cancer, heart disease, premature death, exposure to extreme weather, and the impacts of pollution and climate change are worse in low-income and BIPOC communities due to systemic oppression and environmental racism, as the other presenters have also said. Clean energy, though, can be a replacement for fossil fuels. We can use it to power our homes and businesses. We can use it to move our goods and people around without causing harmful air pollution. I just want to mention one other specific source of climate changing gases and air pollution, which is natural, quote unquote, natural or methane gas. It's especially harmful when it's burned in the home, but it also is a big driver of climate change. So the gas stoves and ovens, when we use them in our homes, can emit more than double the allowable outdoor standards for nitrogen dioxide inside of our homes. And additionally, they're a source of methane. So NO2, the gas that harms when we're exposed to it, is emitted when stoves are lit or when we're burning gas inside of our houses. It's actually just goes into the air we're breathing. Most of the methane emissions from stoves actually occur when the stove is off. So even when we're not cooking, gas stoves are producing pollution. The Inflation Reduction Act has many provisions to help households transition to non-emitting efficient electric heat and appliances, such as electric stoves instead of gas stoves. Some of the programs and provisions in the Inflation Reduction Act include potentially up to 100% point of sale rebates for our lowest income households. So these programs can be a huge benefit to help with some of the problems that Lachey was discussing throughout our state. I want to pause there because I'm going to come back to this, but these programs are written into law, but they are still being implemented. The rules are still being determined in states and in rulemaking agencies like the EPA. So it's a really important time for people to understand what's in these laws and get involved when there are public comment periods. But I'm jumping ahead, so I'll go on. The solutions to these problems from the energy standpoint are to electrify things and clean up our electricity grid. So if we electrify and clean up the electricity grid, we can reduce our exposure to the air pollution. We can also reduce greenhouse gas emission and overall improve health. We can use clean energy to charge our vehicles and to run our appliances, to heat and cool our buildings. We can use on-site solar with battery storage to create resilient buildings. The pictures you see here are buildings in Athens and Winterville, Georgia, that are resilient community centers with battery backups. So if the power goes out, these centers will stay online, providing essential safe services to the community. Efficient electric appliances can reduce indoor air pollution and reduce risk of fire when they replace gas appliances in homes and buildings. And distributed solar around the state can make our entire electricity grid more reliable. There's many, many side benefits of electrification. And there are provisions in the Inflation Reduction Act to increase clean electricity powering all of our homes and to encourage things like rooftop solar and help families replace appliances in homes. Excuse me. Another way that we can bring the benefits of clean energy to our communities is through electric vehicles. These can bring cleaner air and improved health to every single community. If there are cars and trucks driving through your community, cleaning those vehicles up will improve the air in your community. There's lots of statistics from the American Lung Association about the positive health impacts of a transition to zero emissions vehicles by 2030 would be, specifically in Georgians. You're talking about over $29 billion in public health benefits, over 2,000 lives saved, over 78,000 avoided asthma attacks, and 385,000 avoided lost work days. So there are tangible benefits to these programs. The federal programs in the IRA and the IIJA provide rebates, grants, and tax credits for electric vehicles. So there's $7,500 rebate for when people buy new electric cars and trucks, a $4,000 rebate for electric cars and trucks, and then many grants and rebates for school districts to replace diesel with electric buses, particularly, which is really important for the health of our students, of our children. Local governments and school districts have had and will have more opportunities to apply for funding for electric vehicles. So far, 127 electric school buses have been awarded to Georgia school districts, and these pictures are from Clayton County, which received is going to be receiving several new electric school buses. And this is one of those areas where the school districts have to opt in. So that's another good opportunity for anyone to build a relationship with their local school district, with their local school board, and let them know, that you care, that you'd like to see your kids or the kids in your community going to school in clean school buses. The opportunities are there. It's up to us to make sure that our communities are taking advantage of them. One other sort of solution that is often overlooked and can solve some of the problems, particularly that Lachey was pointing out about low-income housing is programs of weatherization and energy efficiency, which can have a lot of health benefits, can also lower bills and reduce the need for energy, making it easier to transition to the clean energy that's going to help us avoid the worst effects of climate change and improve our communities and health. Through weatherization and energy efficiency brings household savings. People who have undergone these repairs in their homes report reduced thermal stress, better sleep, fewer bad mental health days, fewer persistent colds and headaches, decreased doctor visits, reduced need for food assistance, reduced carbon monoxide poisoning and fires because people don't have to use dangerous heat sources when they've had their houses fixed up, and decreases the need for energy for all of us. The Inflation Reduction Act, the IRA, has some really wonderful rebate programs and other funding for households and businesses to improve weatherization and energy efficiency programs. There are existing programs in Georgia, utilities such as Georgia Power and local and state agencies also currently administer weatherization and energy efficiency programs. They're going to get sort of beefed up by the Inflation Reduction Act. And that's another opportunity as the state determines how to put these programs into place. That's another opportunity to engage with them and say where you know the needs are and what kind of needs exist in your communities in terms of weatherization and the kind of safe and healthy housing that we know we need. Finally, the White House has set a goal for a 50% reduction in greenhouse gas emissions by 2030, and this is a goal that's in line with trying to reduce the overall negative impacts of climate change. The two bills that I've talked about, the Infrastructure Investments and Jobs Act and the Inflation Reduction Act, are expected to result in a 40% reduction in greenhouse gas emissions, leaving 10% up for grabs, right? So, and these reductions come through all the programs I've mentioned, as well as other funding sources for states, tribes, and communities, and other investments. We can get the additional pollution reduction from EPA rules and other administrative rules. Where in the Renew Georgia campaign, we're going to be focusing a lot of energy on the EPA rules this next calendar year, because we know things like a methane rule is coming up right now, which would cut methane and other harmful pollution from the oil and gas industry, which is a major driver of climate change. We also would we'll see a soot rule, which would set new limits on particulate matter pollution. We'll see carbon dioxide limits on carbon plants rules. And what happens is the agency writes a rule and then puts it out for public comment. There's usually a 60-day public comment period. And that's a really important time when they have written these rules. They need to hear from the public about how pollution is impacting them. And I think nurses and medical professionals are in a really good position to inform the EPA specifically about how air pollution is impacting patients and impacting your community. There's a couple of other places that we look at in Georgia to see what kind of good policies we can get and how we can influence policy. That's my timer. I'll be really quick. We look at the Georgia Public Service Commission, which sets rules for Georgia Power, the major utility in the state, and the state legislative session, which is going to begin on January 9th and end on March 30th, where we expect to see bills related to electric transportation, solar, and energy equity. And again, that's a great place to engage, to call and email your legislators and make comments at the Georgia Public Service Commission hearings. And I want to say, I think nurses and medical professionals are in a really key and critical position to inform families and inform elected officials and inform administrators about how pollution might be impacting your community. I know it's been really valuable to me as a mom of a kid with asthma to have medical people tell me about how high heat days are likely to make it harder for my son because he's going to have, that makes it makes the air pollution worse, makes it stick closer to the ground. So things like that, letting people know about the incentives for weatherization and clean energy retrofits. And then engaging with your elected leaders, submitting comments when the EPA is considering rules that regulate air pollution, and getting involved in your own community where people are doing the work to create the energy transition, right here at home. So there's organizations like mine, like Renew Georgia, that put out this information, let everyone know when there are opportunities to get engaged. And I would encourage you to join an organization that's doing that so that you can, provide that important voice. So with that, I will wrap up. Thanks so much. I appreciate it, and happy to take any questions.
Thank you all so much to our panelists for your comments, both on the health impacts of climate change that nurses are already seeing, whether you're at the bedside, working in research like Dr. Chicas, working in the community setting, we're already seeing and treating those health impacts. And then Carrie for wrapping it up with several of the programs and bills that are already underway and available for us to kind of get involved with outside of our nursing work. I think you kind of touched on Lisa's question of how certain organizations are getting involved with U.S. agencies. And I would just kind of add to that the Alliance of Nurses for Healthy Environments is another resource for nurses who want to get more involved in this type of advocacy work. It might sometimes seem a little bit daunting or difficult to get involved, but I think Carrie made a really good point that nurses have a lot of really important stories to tell of patients. Lachey mentioned a lot of really important statistics that parents and mothers in Georgia are dealing with in terms of public health and urgent statistics, I would say. I'm going to see if we have any other, it looks like we have a couple more questions.
I do see one there by Bridget Brown.
Yeah, definitely.
I can answer that. So it says there, her question says, thank you for the comprehensive shocking probe in the state of maternal health in Georgia. Given the known long-term impacts of pregnancy health on child wellness and cognition, are there any federal, state grants or programs that help pregnant mothers relocate to cleaner environments? I'm not 100% sure of exactly the names of those programs, but I think that the thing that would probably help more is getting like HUD homes and these agencies that already have the public housing developments, is getting them to go in and fix. They kind of know some of these problems exist. And so going in and fixing maybe the water pipes or as we've mentioned, doing the energy efficient, you open yourself up. And what ends up happening, and this is not just the state of Georgia, kind of across the Southeast, I will tell you I'm a part-time staff nurse, the vulnerability of, we ask the question, right? So I may ask, do you have clean drinking water? Do you have electricity at home? And the reality of it right now is that we don't have enough, and you may go on a waiting list for 3 years. So you put yourself more at risk for defects stepping in and taking your children because you don't have electricity, right? The right answer would be, right, in euphoria or in the, happy world, we would, yes, move the entire family to a more suitable housing place. If that's not available, once I've now admitted that I don't have clean drinking water and I do not have electricity, we're state reported, we're required to report. So now I have to report that to defects. So what was a question that was supposed to help me, I may have now put myself at risk to have my children taken out of the home until I can actually be provided with better housing. So that's kind of where we are with that.
Which kind of actually brings us back to, again, what Carrie was mentioning, having more support for these programs that are kind of beginning to come out, weatherization of homes, implementation of more efficient transportation for communities to improve air quality. And nurses definitely have the voice and the experience to be a part of this really important conversation for public health. I do see that we're at time, but I wanted to thank folks for attending and putting in those great questions to our Q&A. Again, this has been recorded, so the recording will be available for folks to come back to, and we will also be following up with the post-test as well. So thank you all.
Thank you everyone for attending today. My name is Charlotte, and on behalf of the entire GNS team, I'd like to just thank you for attending this presentation and how important it is to understand the impact climate has on our health. Again, thank you, Sarah, Carrie, Lachey, and Jessica, and Dr. Shikas for attending and for presenting. We appreciate it. We hope you have a great day.
Bye.
Our conversation